Hi, this is Josh. I'm a pharmacist with pharmacisttips.com, here to tell you about the medication Mirtazapine. Specifically, the topics we're going to cover in this video include what is Mirtazapine, um, the common dosages for Mirtazapine and uses. We'll cover the common side effects. We'll talk about weight gain, other side effects, and warnings and cautions. And then we'll touch a little bit on withdrawal symptoms that can occur if you abruptly stop the medication. So, as with all my videos, it's for informational purposes only and is not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. So, what is mirtazapine? It's an interesting antidepressant that it's also an alpha-2 agonist. The interesting thing is it affects the alpha receptors related to norepinephrine and serotonin, and that gives it a unique antidepressant effect, different from other antidepressants on the market, and it can sometimes treat the depression symptoms with fewer side effects for a lot of folks. So that's really interesting. U.S. sold under the brand name Remeron. It's available in 7.5, 15, 30, and 45 milligram tablets. There is also an oral disintegrating tablet. We don't see those used as often. Common dosage. Typically, we're going to, of course, see it taken at bedtime with or without food. And we usually start at 15 milligrams at bedtime and then increased 15 milligrams every 1 to 2 weeks if we're not having the efficacy we're wanting. Max dose, usually 45. There's been a few studies, 60 milligrams a day. That would be extremely rare to use that much for somebody. So what are the uses? Well, of course, it's an antidepressant, so we see it used for that a lot. We see, especially for folks with sleeping problems, really, really helpful. There's nothing worse than you're not feeling well, you're depressed, and then you can't sleep. That only escalates the situation. And this medicine really does help a lot of people get some sleep so they can really improve their mood. Off-label, meaning it was not originally studied for this, but over time we find it helps with these chronic headache prevention. So folks that have repeated headaches, sometimes it can help with that. Panic disorder sometimes can be related to depression, and also some people with panic disorder have extreme difficulty sleeping. So that does make sense for this. Most common side effects: drowsiness. Over half the people experience drowsiness. Most of them probably welcome it, as this is dosed at bedtime and it can help them get a good night's sleep. Weight gain. So weight gain can occur in up to 12% of people. So that is something to keep in mind. For some people that is difficult. An increased appetite can contribute to that weight gain. So dry mouth, 25%, 1 in 4. Constipation, 13%. Increased cholesterol, 15%. So, with the weight gain and the increase in appetite, it's a little tricky, but, we'll be mindful of our appetite, make some good food choices, maybe increase exercise can sometimes offset those. But that is a potential side effect, and sometimes people do switch the medication because of that. Other side effects, we can get some swelling or edema, dizziness. Some people report a change in their dreams, rash, itchiness, cough, difficulty breathing. These are all less than 10% or even in the 1% category. So these don't happen very often. Change in liver functions, sometimes some mental confusion, agitation, change in blood pressure, muscle weakness or back pain, tremor, and other side effects can occur. What are some of the warnings that we worry about with this? As with any antidepressant, we watch for suicidal thinking. Extremely, extremely rare, but if you find yourself in that category, please seek help right away. We need to be cautioned in folks with bipolar disorder, as it can cause mania or hypomania. Serotonin syndrome, extremely rare syndrome associated with antidepressants. Vision changes can occur. Withdrawal, we'll talk about that just a little bit more. Restlessness, it can affect sodium levels in the body. We need to be cautious if people taking this have a history of seizures. And there is a potential for drug interactions. Remember, it is always best to go get all your medicines from the same pharmacy, so your pharmacist can screen for drug interactions, and that you're healthcare providers are aware of all the medications you take, so they can watch for them as well. Withdrawal symptoms. Typically, to avoid withdrawal symptoms, we're going to taper this over 2 to 4 weeks, especially if you've been using mirtazapine for longer than 3 weeks. You probably want to slowly decrease the dose. It can take, some people require taper up to 6 months. It depends. Let's say you've been on mirtazapine for years. You're going to want to slowly taper that. As abruptly discontinuation symptoms include nausea, vomiting, diarrhea, sweating, chills, tremor, fatigue, change in appetite, sleep changes. Just it can be really uncomfortable. So some people want to slowly walk that dose down just so they don't have to go through all those withdrawal symptoms. I appreciate you watching. Go ahead and ask questions about mirtazapine in the comments below. I will do my best to answer it for you. I'd really appreciate it if you like the video and subscribe to the channel. Thanks again for watching.